I'm Mickey Anderson. I'm data lead at Celsus, and I'm fortunate to be joined today by the rest of our data team. So we'll have Caroline Anderson here and Alexander McTeer. Some of you out there probably know them already, but you'll meet them as we go through the day. Sorry, the 90 minutes. We're extremely fortunate to be joined by colleagues from local and central government to talk about their direct experience today. We'll introduce them properly as we move through the agenda today, but a big welcome to Caroline, Scott, Pamela, Kirsten and Craig. So and thanks for making the time today to share your experience. So 2020, it feels like a year we should all be trying to forget, but what we're going to try and do today is pull some positives from the wreckage of 2020. And we'll look at important developments, progress and positive change around data. So it won't all be a gloom and doom. Hopefully we'll be looking for those things that worked during the year and celebrating those. So let's run through the agenda for today. So first of all, I'm going to set the scene and just highlight a few kind of key developments from last year. We're then going to move on to Alex, who's going to introduce the Child Protection Minimum Data Set and talk to Caroline about that and her experience of bringing that data set into a local authority. After that, we'll have Caroline introducing the PACE programme, which is was Celsus's Permanent Care Excellence programme, which finished in July last year. And Caroline will be speaking to Scott and Pamela, who were both PACE leads in some of our local authority areas. Then I'll be asking Kirsten to share some of her experiences about implementation work in Dundee. Kirsten has quite a broad range of experience and we'll probably touch on some of that as well. I'll finish with a talk with Craig from government to look at the national data collections. You might know at the end of the year there was a review of the children's social work returns, and also during the year the Solus COVID data set that was put in place very rapidly. So when we're talking about data today, Celsus has a real interest in data with a purpose. You may have been aware of previous events we've had around data to make a difference, and it's a real theme for us. It's about practical data. So today really it's about data to inform decision making, and it's hard to overstate the importance of some of these decisions. When we're talking about children in need of care and protection, we're talking about the state intervening in family lives. So it's really important that we get these decisions right and that we use as much information as possible to help us make those decisions. So it's decision making really, and the link data informed decision making really is our theme for the day in some respects. So we're fortunate to have examples of data decision making at 3 different levels today actually. So if you think about it, first of all, if you think about the child and the decisions that are made around that child, we're thinking initially about data to inform decision making directly around that case. So it's information about the child, their family, their circumstances, trauma experienced, and that data can be used to where it's difficult for a child to have a voice. We can actually represent the child through data to some degree at that individual level. So the data we'll look at today in Dundee and also in their PACE programme is very much about that individual level data. Taking it up a level to aggregate data, we'll then look at local authority level data, where data, again, we're making informed decisions, but at this level we're using it to decide about service provision, demand, looking at kind of variation across areas and things like that. So at that kind of service level, again, looking at data informed decisions, we'll be looking at the Child Protection Minimum Data Set, which operates at that level. Taking it up a level again, if you think about all those services out there, we want to pull that information together nationally to get a picture of how we're performing as a country. And that's where I'll be speaking to Craig about some of those, about pulling data together at a national level and how that is used to inform decisions about policy development, demand, variation across the country and things like that. So three levels really of data to inform decision making. Now, in an ideal world, if we were getting the first bit right, all that data around the child, it would naturally feed into better data within local authorities, within other agencies, and then that would lead to better data at government level. So if we get the basics right, you could see how it could kind of flow upwards into a better national picture. The problem is we don't live in that ideal world. Scotland isn't quite there yet. So a few key points I want to make about last year. If you take your minds back before the storm, actually, to roughly this time last year, we had the launch of the Promise, the outcomes of the independent care review. And in data terms, there were some really interesting observations from that. So I'm just going to read a couple of the things from that. The care review, the strong statements that were made about data included that we have a broken system in which current data is fundamentally flawed, and it cannot be relied on to support good decision making on its own. I relate that to the themes I've already kind of raised about decision making today. That's a pretty strong statement about data in Scotland. It goes on to say an individual's journey of care is not represented in data collection. The data collected on the care system, inverted commas, reflects the system and its processes and outcomes rather than the experience of children and young people that move through it. So it's a really kind of critical message there about what data is for. And the care review outcomes, really what they're focusing on is early intervention. It's not about better data really on children who are in care. It's about better data to help stop children getting into care. So it's about that upstream action to prevent escalation. So it's quite a lot for us, I think, to reflect on in terms of data and those observations from the care review. We're in a position really where we should be trying to get data right for every child to guide intervention at the earliest stage possible to prevent escalation. Okay, so I mentioned already the SOLACE COVID vulnerable children data set that was introduced during the year. I just want to make one point about that before we pick up on it a bit later. If you think about the usual process for government to collect data from the sector, it's usually through the children's social work statistics and the class returns. It can take about 3 years for an idea for a change to class to actually find its way into the return, be collected and be analysed at government and then published. So 3 years maybe from government being interested in a bit of data to actually having that in front of them and sharing that with the sector. The SOLACE data was up and running within a couple of weeks. So we went from, if you think about it, we went from annual information going to government to weekly information being provided to government and critically published by government so we all could see it on a weekly basis. Now, that data was far from perfect, is far from perfect, and it has raised all kinds of issues, and I'm acutely aware of the pain it has caused in the sector. But look at the opportunities there too. Look at the change that we managed to achieve in response to a crisis. So again, something maybe to learn from that about frequency of data and responsiveness. So I want to touch, final thing I want to touch on is the review of children's social work statistics, which, as I said, took place in November. As part of our census response to that, we had a look at the returns that are made in England and Wales. And I'm afraid that Scotland compares very unfavourably to those returns in terms of how the information collected reflects journeys through systems. And again, reflecting back to what the Promise said about that. So the English return, the children in need return, it captures information from first referral to social work services right through processes after that. In Wales, they collect the children receiving care and support census, which gathers data for every child with a care and support plan. So there's data for those who receive support but aren't involved in child protection or aren't involved in the care system. So you can see that they have approached this idea of capturing information on the journey of children in a different way to we have in Scotland. I would argue that we need a fundamental change in how we collect data in Scotland, and we need a step change, but I'm acutely aware that there are challenges in doing that. So my final points really are just about some of those constraints. Today is about celebrating some of the things that have worked well in Scotland and looking at some examples of people trying to make a difference with data. But I just want to reflect first of all on the sector as a whole. In terms of constraints, there are real constraints in terms of people. Data resources in local authorities are stretched to the limit. Practitioners in local authorities and managers are responsible for data inputting, and again, that is time that is needed for other things. So I don't think the balance is right between the burden in terms of data collection and what you get back as practitioners and managers. At government as well, there's limited capacity for analysis. And we also have this unfortunate situation where the institutional memory at government is very short. So sometimes changes are introduced and people change and we kind of forget why things were introduced in the first place. So I think there are some issues just about continuity and things like that, and issues around people in the sector generally. Second thing is about processes. A key characteristic of Scotland with our 32 local authority areas and other agencies involved in protecting children is the variation across the country. It is just huge. In our PACE work, we found all kinds of differences in terms of thresholds for intervention, approaches to assessments, report writing, decision making, preferred legal routes used, and timings of reviews and things. So it's a massive challenge in Scotland when we're thinking about standardisation. And finally, in terms of constraints, almost 2/3 of our local authorities are using social work information systems that are effectively out of date. A lot of local authorities aren't in a position at the moment financially to purchase more up-to-date systems. So it's just something to bear in mind. Now, these systems, I was involved in putting one in actually in a local authority almost 20 years ago, and it's still there running. So just think about how the data environment has changed and how we interact with data and how, over those last 20 years. So having raised all those constraints, I'm now going to put them to one side and ask you to do that as well. Because what we wanted, as I say, look at is some of the positive things that we can pick up from the last year. So I'm going to stop there. Today is about the art of the possible, I guess, and I'm going to pass over to Alex to speak about the Child Protection Minimum Data Set.
Thank you, Mickey, and good morning, everyone. So yes, I'm Alex McTeer. I'm part of the CELSIS data team, and the next 15 minutes or so I'll be introducing and talking about the minimum data set for child protection committees, along with Caroline McConnell from East Abantshire Council. First of all, there'll be many of you for which the minimum data set is unfamiliar, so just a quick orientation around that. At its core, there's 17 indicators that are collected quarterly that enable local areas to get a better understanding of their child protection processes and the children subject to them. And the 17 indicators are there to be consistent and boost that consistency and standardization across the country around what is collected and address some of that variation that Mickey referred to. But it's more than just, and this is important, it's more than just a set of indicators, because that can build and lead to variation in how they're implemented. So the resources also include an Excel workbook that support local areas to collate and then present their data through suggested charts and tables on how to share the data, and also a report template that local areas can then use to lift up the key findings, the key data, the key charts and tables to their committee members and designed to be quite accessible, concise and informative for committee members. So thinking back, a lot of progress has been made. In 2019, that was the year that we really spent time developing, testing, refining the minimum dataset package, if we like to refer to it as that. And then once we were confident in its usability, then we sought to share it across the country via workshops with all committee areas. So the foundations of the work were done in 2019, and then 2020 has been terrific to see, despite COVID, despite the pressures that have been put on, that so many areas across Scotland have started to use it. And for me, that's really testament to the work that we at CELSIS, as well as our test partners, have put into it to make sure it is as user-friendly as possible. So it's here that I'm keen to get Caroline's views on her experience of using it within Eastern Berkshire and also the impact it's had. So I'll hand over and welcome Caroline.
Morning, everyone. In terms of our experience of the minimum data set and the introduction of it within Eastern Berkshire, I can say it's probably been a really positive development for us. Overall, it's been really well received by our CPC, and I think this has really helped us to embed the process within our information subgroup, which really highlighted the need for our multi-agency analysis within this group to be much better than it previously was. This has been really key to the process. In terms of the data itself, we had to implement new ways of recording, new management processes, new Care First activities, really to meet the needs of the minimum data set. And I think this has probably led to us having a more robust understanding of our data. We have implemented recording of initial core groups, parental attendance at these, and referrals to SCRA from case conference. This was areas that, although they were probably recorded in case notes or in minutes, but we weren't able to pull this information electronically in any kind of worthwhile way. So this has made this part of the minimum data set really, really worthwhile for us. There were also a number of local indicators in our original quarterly report that we had developed over a number of years. And it was probably our first question to Celsus: what can we do with this data? We find this really helpful locally and we don't want to lose it. And fortunately, with the help of Celsus, we've been able to include some of this data. Examples of this would be risk factors recorded at investigation stage. We implemented this quite early into our quarterly report, and we've found this really helpful as a local authority to look at what's really coming through our door in terms of CP. And I suppose, being a small authority and our number of registrations being lower than other authorities, to have those risk factors at the investigation stage is really helpful in terms of getting to grips with what is actually happening within our local area. We've also added sources of investigation, so the agencies that were responsible for the initial referral, and this really ties back to the multi-agency analysis within the group and helps agencies understand a bit about where our referrals are coming from, where our investigation sources are, and looking into that in a bit more detail and what that's about. We look at our conversion rate of investigations to case conference, and we also include professional attendance and report submission at case conferences. So this is all local indicators that Celsus were able to develop our own workbook around, and we include these in our quarterly report.
Yeah, so we were trying to make this conversational, but I think the lag makes it a little bit tricky. But yeah, I was going to ask Caroline about a key aspect of the minimum data set is that it's quarterly data. So interested to get the Eastern Berkshire perspective of how the quarterly data is used alongside the weekly COVID-related solace return that to government and the data that provides, and also the annual return that you develop through the social work systems to government. So how does the quarterly interact with the other data?
The quarterly data, I think, allows us to analyse much more up-to-date data, and it's more relevant for the CPC in terms of taking actions forward. The data validation that takes place for the minimum data set is, however, very helpful in terms of the annual return. It picks up on issues much quicker. We get these resolved within our local recording system. So the balance of quarterly reporting in terms of data validation is really good, but the annual return continues to allow us to analyse on a full year basis, which is really important, and also allows a comparison with other authorities for relevant indicators. So that, you know, that is still key to what we do in terms of our benchmarking data. So I think the quarterly data does definitely feed into the annual, and there's a place for both of them. I think probably just to mention at this point, as a CPC, we did, however, agree that the minimum data set would be presented 6 monthly rather than quarterly, though. We felt that this gives us time to scrutinise and discuss the minimum data set and the detail that's needed, rather than being presented quarterly and not covering it fully. So we continue to produce a quarterly report. It's fully analysed at our multi-agency subgroup, but we only take it to CPC every 6 months. If there's any issues identified within the quarterly report, then we would take a technical note up to the committee anyway. So we do consider it quarterly, but formally report it 6 monthly, and that may be helpful for other authorities, particularly smaller authorities, I think, like ours. So it's worthwhile considering that and weighing up. We did do the first couple of reports presented quarterly, but we felt we were getting more out of them going 6 monthly.
Thanks, Caroline. I think you've explained and brought to life how the minimum data set is a standard package, but it can be used flexibly in terms of bringing in additional indicators or in terms of the frequency of particularly reporting up to your committee, but making greatest use of making sure that data collection and at least some analysis is happening on that quarterly basis. I'm just going to finish off a bit of a forward look because we've reflected on 2020, but in terms of 2021 and looking ahead from a CELSIS or a national perspective, I think there are certainly 3 key areas of work I'm keen to put across to today's audience. So firstly, that we've got to make sure that the minimum data set and the indicators contained within it really align with the new national guidance for child protection, which is due to be published later this year or later this spring by the Scottish Government. There's also scope to continue to support local areas and how they're analysing and sense-making the data, so that it isn't just a data collection exercise and presenting the data, but we're actually really getting the meaning out of it and the implications for local services and decision-making. And then slightly to the side, we know that a similar data set, quarterly data set, is planned around adult support and protection. And I think it's important that we think about how the two can not necessarily come together, but at least work together to provide us with a better understanding at a public protection level around some of the key themes emerging and how that impacts on local services. So that would be my national take. But Caroline, from a local perspective and Eastern Branches perspective, any key pieces of work that you would like to see progress and be prioritised in the coming year and beyond?
I think in terms of the minimum data set and the impact on service provision, I think the scrutiny questions within the minimum data set and highlighting the implications for the Child Protection Committee has really helped us focus on particular areas for further discussion. We've used it to highlight training needs for staff. We've updated our consultation framework for children and families who are involved in the CP process. We've also ensured that local service provision is targeted to the risk indicators that have been evident in our minimum data set. And some examples of this would be how we use our Women's Aid Service, our Families Affected, our Alcohol and Drugs Recovery Service. So this has been some of the questions and issues that we've taken to the CPC and really kind of scrutinise the data in this sense. One of the questions we've been considering as a local authority and probably over the last year and using the SOLAS data, we look at that weekly within our Public Protection Liaison Group, but we've also been looking at other data, and our minimum data set has formed part of that. And we're really thinking about how do we make the comparison of our data nationally. We've started discussions with a comparator local authority, and we're looking at redacting our minimum data set just now for sharing. And we've set that up on our own through our own contacts. But I know our Chief Social Work Officer was keen to look at some kind of information sharing agreement around about this. And I suppose the question for us would be whether CELSIS and the Scottish Government could provide some input and some assistance on this. We also feel that it's key that our report moves more towards including qualitative data rather than just data itself, and becomes really, really more meaningful. So I think that's some of the key areas that we would see locally in terms of taking the minimum data set forward and improving it more.
Thank you, Caroline. So that's a very quick 15-minute conversation around the minimum data set, and thank you for Caroline to sharing Eastern Branches' perspective and experience of using it. Before I hand over to Caroline, if you did want more information around the minimum data set, the The resources are open access. When I talk about the Excel workbook, etc., and the report templates and the list of indicators, they're all open access on our website and can be found there. But now I'll hand over to Carol Ann so we can hear about the PACE programme.
Good morning, everyone. I'm Carol Ann Anderson, one of the data analysts at Celsus. I'd just like to take a couple of minutes to give a brief introduction of the PACE programme for those who haven't heard of it. In 2012, the Scottish Government commissioned the Centre for Excellence for Children's Care and Protection, better known as Celsus, to support local authorities and key partners to reduce the time it was taking for children in need of care and protection to have a safe, settled and secure home. This home could be with parents, other family members, in foster care and residential care, or with prospective adopters. The Celsus team supported local areas to use quality improvement methodology to understand how their current systems were operating, and then to test new ways of working in a small way to build evidence that these changes were in fact improvements to their systems. These improvements to the system would in turn improve decision making and outcomes for infants, children and young people. The Permanence and Excellence programme, better known as PACE, was established and provided direct support to local authorities and partner agencies with the aim of enabling more effective and efficient decision making and identifying and sharing good practice. The PACE programme used the quality improvement methodology as a framework for introducing, measuring and sustaining improvement in permanence. This approach was shown to be effective specifically in the area of permanence and fitted with the Scottish Government's wider strategy for public service reform. Data and measurement was an integral and pivotal part of the improvement process and was used in the PACE programme to track each child on their journey to physical, emotional and legal permanence, allowing local learning to support the process of change. Data was critical to evaluate and guide improvement. Without data, we often make assumptions. It was challenging to get data, especially data that would guide improvement. Some information management systems don't lend themselves to data extraction, and what seems like an easy task becomes a time-consuming manual task. In other areas, there was no dedicated data roles in the local authority to support the collation and analysis of data. But when we got sufficient data to understand how the system was working, it got people on board. They wanted to know more, highlighting areas where change was required and then monitoring the impact. A picture paints 1,000 words, therefore it was significant that the data was displayed visually. We used run charts, bar charts and timelines. Behind the data is a story about each child's journey. Timelines provided that visual story from placement movements, change from social worker, school moves, as well as other significant events. The data provided the hard evidence which aided the motivation to change. So to get a better understanding of the learning challenges and differences data made to children's permanence journey, I'd like to introduce you today to Pamela Hoy, Area Manager in Children and Families at Argyll and Bute Health and Social Care Partnership, and Scott McCallum, Service Manager with Children's Services at Midlothian Council. Both were actively involved and leaders of the PACE programme in their respective areas, so I'd like to thank them for joining us today. So we're aware data was key to the improvement journey, but on review, what have we learned from the data gathered for PACE? So if I could turn to Scott first. Scott, prior to PACE commencing, I met with you and one of the other managers to discuss the Midlothian data. And before we even get started, I noted improvement. We've got a wee slide I think we could share here as well. So just wondering, Scott, if you could tell us a wee bit more about this.
Yeah, thanks, Caroline. Yeah, I mean, what you're looking at on the screen just now is the children that were accommodated in Midlothian, probably going back to 2011 right up until the end of 2019. We knew we had a problem around about 2014. You can see the huge variation in decisions that were made for children in the care system. So every dot here represents a child, and up the side is the length of time it was taken for children to be referred to a permanent SLAC review. So up until kind of February 2015, huge variation in the time it was taken. So what we done over the course of 2014, we developed a permanence policy and a flow chart and launched that in February 2015. And you can see the difference that made. I don't know if Julian can hover over where the dots become a bit more consistent round about the 10-month mark. So we knew when you shared that with us, Caroline, that kind of demonstrated to us that we could make a difference, that developing practice and improving process would have a positive impact on the length of time children spent in the care system without having a decision made. So when that was shared with us, that gave us real kind of momentum, motivation, really provided an impetus to improve further. So kind of moving on to November 2017, you can see when PACE was introduced in Midlothian, and we introduced a number of practice developments that included introducing a leaflet that was shared with parents at the point a child was accommodated, introducing a 2-week planning meeting after the 72 review. We would have a 2-week planning meeting, and we brought in an additional 3-month LAC review. And you can see from the data that things improved further. So that demonstrated to us that gathering this data, and I have to give a shout out to Janet Penman. I understand Janet's on the call this morning. Caroline, you always said to us that the data that we were gathering was kind of sophisticated, and it allowed us to better understand where we needed to improve and develop our practice.
Just thanks, Scott, there. I think it was quite early on in my PACE journey as well, so to come into Midlothian and see improvements so early on was fantastic before the PACE programme actually got up and running in Midlothian. And I think it was heartening to see so early on the data being useful, helpful, and for you to actually see that the data was going to showed a change for you as well. Can I just turn to Pamela now? So Pamela, in Anguilla and Bute, you were using a tracker as a data gathering tool. Can you tell us a bit more about the tracker and how you utilised it to gather data?
Yes, when we first joined the PACE programme, we did have a tracker in place. We were drawing the information from our Care First system. But when we worked with Caroline and with Kirsty, we understood that we were gathering far too much information. We were gathering every piece of information, and actually we couldn't make sense of it. It wasn't giving us a clear picture for our children and young people. So we had to basically start again. We learned from other authorities. Caroline and Kirsty were able to share with us, what actual key information we actually required. We got a bit smart, and we tied that in with the national returns, the class returns, so we were gathering that information where we were gathering what we needed. So we learned from other authorities. I think Midlothian, we can thank you for that. And we got those key things. And we started again, we set up a new tracker. And we were relying on a Care First system, which was pulling information that social workers were inputting. So we were relying on that being up to date, and we found out that that actually wasn't the case, and a lot of the information was out of date. So we didn't have a dedicated data lead or a data analyst, and then that became the focus of securing that. And once we got that into place, and I'd like to give a shout out to Caroline Bird, because without her we wouldn't be where we are, once she knew what to do, she got that set up, and then with our new tracker we're now able to gather the information we need, and we can actually track every individual child successfully and have a true reflection.
Thanks very much for that, Pamela. If I could just stay with yourself, so if we can touch on the challenges that I had mentioned earlier. We know that every area had challenges. Can you tell us a wee bit about the challenges that you had locally within Argyll and Bute and how you actually overcame them?
Yes, Argyll and Bute geographically is a very large authority. We've got 4 areas, so standardisation in practice for us was probably something that we found quite early on. And as I said before, getting that data lead and having been able to standardise that, having the data lead inputting the information. So what we did was we basically realised that collecting of data was best left to the people who understood it and to the data leads, and it was more of an administration role. And so the monthly tracker meetings, we introduced the data lead attending that. So while we're having these monthly tracker meetings and the focus is securing the permanency plan for each child, the data analyst is joining that meeting, but her focus is making sure that information recorded in Care First, which we draw from, is correct. And she uses that meeting for her to ensure that any information that's missing, we can use that meeting to also update that. So it was about that standardisation from the 4 years of Gyle and Bute, pulling that together to that monthly and getting that focus and actually getting correct information about every child and young person on the system as being a priority, as well as obviously the social work processes that we had to secure.
I love the way you make that sound so simple, Pamela, but it was incredible to actually work with you, to see the development within the local authority, as you've mentioned as well, the work from Caroline and how it was all pulled together. But I think it was just the dedication for each and every person that was involved to make this work. Finally then, are you still using data? This is the big question we all ask. Could you tell us how data is making a difference specifically to a child or family? Scott, if I can come to you, are you still using it? Are you doing anything new? If you could share a wee bit with us.
Yes, we're still using data, Caroline. We have a 6 weekly permanence overview group that tracks all children who are in the system and awaiting a decision. We understand what children are approaching a permanence lack. We are aware of children that have been referred to a permanence lack and have since been referred to the adoption panel. And we're aware of children that are sitting kind of waiting pre-court or actually in court. We know exactly what children have kind of drifted beyond the 30 weeks that we have set ourselves for a permanence decision. And we're using timelines. I mean, I attended a PACE workshop almost 4 years ago now, and I was a manager from Aberdeen City Council, I think, that done a presentation on timelines, and I thought they were absolutely brilliant. And we introduced them last year into Midlothian, and social workers and operational managers love them. And we've developed that into kind of holding mapping meetings for children, for cases that are stuck, or perhaps where there's a bit of conflict around the contact and children's hearings, perhaps being reluctant to reduce contact. Those kind of scenarios, we're using data to develop timelines, to present that to a children's hearing, and that's making a material impact on the lives of children in the care system.
Thanks, Scott. I really appreciate that. I think what is great to hear is often that, as we know, programmes can be introduced and they may work at the time, but I think the whole point of quality improvement is that we weren't just going in with a particular programme, we were going in with a framework that was obviously looking to support, and data, as we said earlier, was integral to making the quality improvement framework possible and work. You needed to know where improvements were happening, and I think what's really great is that when we referred to the first slide, that you had seen you'd seen changes that you had made within Midlothian right at the start, and you actually could physically see the data. Those changes you had made a significant impact. So to hear that the data is still key to day-to-day business is great, that it's still helping. And also as well, when you discuss the timelines there, to hear that the timelines is something you are actually developing further. You're mentioning there that it was something you heard about 4 years ago. 4 years on, it's something that you are bringing into practice that's obviously helping you to review your children. Pamela, if I could turn to yourself and just maybe ask the same question there, is there other ways that you are using that data or have used data to help use in Argyll and Bute?
Thanks, Caroline. Yes, our data gave us a picture and made us understand the children who are care experienced and where they are looked after. And it was very clear that the large majority of our care experienced were placed with family, and their permanency plans were to secure them through a kinship order. So that directed us to, that's what we needed to look at. And at that stage, permanency plans for children who were with family were going to the approval and matching panel, which was adding, because you were having to complete, in-depth reports, etc. I won't go into that detail, but it was adding a lot of time on to securing that plan. That wasn't required. So what we did was we looked at that, and that's when we've set up a separate kinship panel, which has the correct threshold, that we're able to move that through quicker. And with evidence, we've been able to secure children with their family members with a legal order and a significantly shorter time. And that was because the data directed us that's where we could achieve, you know, the most significant impact. The other area that the data led us to was it was quite clear that we had a significant delay in getting a legal meeting, and at that point that was chaired by a locality manager. And actually, when we looked at it, they didn't really have the availability. It was hard to get that slotted in. So we made a practice change and policy changed, and our care assessment and reviewing officers took on that role. And again, with evidence that we're able to get the legal meetings now, and as part of the meetings scheduled in, there's not a delay in waiting. So again, that the data led us to that isn't probably what we'd initially thought were our priorities to reduce the timescales, but actually the data led us to evidence that was two areas we could clearly do, and actually with evidence that has been the case. And just to say, you know, you've moved on, is I've changed roles, and I was really delighted to be part of a meeting this week where the senior manager for resources is actually continuing to improve the kinship panel, and actually there's further changes to enhance that happening. So, you know, it's still going on, and it's with thanks to the support we had initially that we're able to do that.
Thanks, Pamela. It's great to hear the updates from you, and it's appreciated the time. I think more than anything, again, just to reiterate the fact that we've obviously, as Mickey mentioned, the programme finished back in July, and just to touch base with you today and just hear how the programme is still, or the quality improvement methodology is still sitting there, it's still working with you. And like you said, Pamela, the data has highlighted areas that you maybe didn't think that you actually needed any attention, bits of the system that weren't quite working. So I think, if anything, it's the data's allow you to look at something and then drill down to see where there is a delay. So I'd just like to thank Pamela and Scott for your time today, for sharing your experiences, and just to say, if there is any questions, as Mickey said at the start, if you could pop them in the wee Q&A box, and Pamela and Scott, if you wouldn't mind taking a few questions at the end. So thanks again, and I'll just pass you back to Mickey.
Thanks, Caroline. Fascinating to hear some of the things that are still going on in the PACE areas. And great to see a run chart as well, although I understand that maybe some people out there couldn't see that. But if you can't see any of that, we've lots of information on PACE on the Celsus website. And if you want to see examples of run charts and things like that, they're all there, all that material's there. It's a great way actually to, when I was saying earlier about how we aggregate individual journeys, the run chart's a great way to see lots of children's journey side, well, parts of a children's journey side by side. Okay, so moving on with the agenda, the next part is for me to introduce Kirsten Yorna, who probably doesn't need too much introduction to a lot of you. Kirsten's been working in and around data in Dundee City Council since 2008. Kirsten has been involved in PACE work there. She's been involved in child protection work there, but I'm going to ask her some questions actually about her work on implementation and improvement work in Dundee. So Kirsten, if I could ask you, where has data had the most impact in Dundee?
Good morning, everyone, and thank you, Mickey, for your kind introduction. Data recently, yes, as in everywhere else, had the biggest impact from Solace, actually, and the quick weekly checking of data and looking at hidden harm. But I'm here to speak about a wider program called ANEW, which is addressing neglect and enhancing well-being. And without going into details, one very core aspect of it is improving family engagement and team around the child processes. So downstream from looked after children and upstream rather from looked after children and child protection. And oddly, perhaps for this group, the biggest impact has been through early case studies where our changes made such a significant difference, and the qualitative data coming out of it made such a difference that senior managers were happy to take it to elected members and to boards and so on to say this program is really worth supporting, because it's making genuine changes to the lives of children who then don't add up in child protection or looked after processes.
Thanks, Kirsten. So again, a bit like Caroline asked for Argyle and Bute and Midlothian, could you tell us a bit about some challenges you faced locally and how you overcame those?
Yes, the biggest challenge with case studies, of course, is to show how it impacts on the wider population, because while you have the individual child, you can't really see the evidence school-wide, never mind population-wide. We overcame that by using a logic model and working backwards and saying, so if this is the outcome we want, what needs to be in place so that early on our assumption can be that changes we make early on for so and so many children will have a similar outcome 1 or 2 years down the line. The other big challenge has been to find reliable outcomes indicators, and I think you all know this is the holy grail we are still all chasing. There is no really one reliable health and well-being or emotional well-being indicator which we can use in Scotland. And the way we've overcome that, because that's what we would want to measure, wouldn't it? Like on the run chart, we want to see how for all the children the health and well-being is improving. And the way we've overcome that is really taking a faceted approach and a whole basket of indicators to show the more complex picture.
Thanks, Kirsten. Some really interesting observations there about early intervention to prevent escalation, which ties in really well with some of the observations from the promise, actually. So that's really interesting. Also, that notion about data not just being about numbers, data being about experience and how we capture that. Again, really critical. I think Scott mentioned that too. So next question we asked you, Kirsten, was could you give us an example of, or could you tell us how you could improve data locally to meet the needs of children and families?
Yes, I think what we need to do, and what oddly we learned and was enhanced through Solace, is very frequent feedback. So if we get regular, frequent feedback rather than, say, annual reports on how a program is doing, that seems to make the biggest difference. So in the case of these children, to be able to feedback for them, so many children are now, whatever, entering one process or another, but the small steps really of what is making a difference. For staff, for instance, we are learning what is making a difference in the lives of children by, again, improving the team around the child process, and we introduced observation sheets. So the staff immediately got feedback on how the team around the child was working. They could then improve it, and that could be part of our larger logic model of, if all team around the child processes improve, we assume then outcomes for children down the line are going to improve. Sorry, does that make sense? It's very hard to do all this in just very few minutes.
Yes, I mean, it is hard, but some really interesting insights there, Kirsten. So I'm going to ask you for some examples of where data locally in Dundee has made a difference for a child or a family, and also where an example of data has actually helped practitioners. When we were preparing for this yesterday, Kirsten, you were telling me about ownership of data and how it's so important for data not just to be seen as the job of the person who gathers data in the local authority. It's about how we feed back to practitioners and managers and make sure that there's shared ownership and visibility of data. And once we see that and we see it making a difference in the impact it has. So to go back to my question on that, Kirsten, just to remind you, it was about examples of data making a difference for child and the family and also for practitioners.
Yeah, so for a child or a family, as part of the engagement at the beginning, we would ask them, you know, somebody preparing with them for a meeting would ask them how they felt about the meeting, and they could circle their emotions. We had a blob tree diagram for those of you who know it. So they would circle as sort of, you know, crossed arms and hunched or fearful. And we again asked them afterwards how they felt. And they would often show an image of two people with shoulders around each other, with their arms around each other's shoulder, which of course is lovely. They felt supported, they were smiling, they were happy, they were relaxed. That was how they felt about the process. And what was important was to have it black and white, because they could then remember how they felt beforehand. The same was true for the action plan, which we used in the Team Around the Child process. It was a very simple action plan, which was co-produced, genuinely co-produced on the table or on a wall if the school had a smart board with the family. And what they could see were the actions they had agreed to do last time may have been circled by a child or commented on by a child. They would see things like attendance measure, which is one of the most common reasons why children end up in Team Around the Child, is low school attendance, a little bit going up or down, hopefully going up in most cases. And if they saw that their action had got a smiley sticker by the child or said, this action never made a difference, I didn't like this action, and they then could use that, the written down format, to create the new action plan, that seemed to make a huge difference for families, because they said, oh, now I know why I'm doing this. Now I know what made a difference. I and my child are being listened to. And of course, if then, because they'd been hit hard again and again in the past, people would you know, get onto them, in essence, knock on their doors and say, why isn't your child at school? So if they then also saw the hard data improving, that combination made a massive difference. And the same, of course, was true for the staff, because they could see exactly the same thing happening. So the interventions they were doing in schools, they could see whether or not that was making a difference to attendance, but it could also see where other concerns were happening. And if I have time, I would like to mention one more example where data made a big difference for staff. So another tool we introduced was called the Early Concerns Map, where a head teacher and a deputy head teacher for a week would write down what concerns came to their attention. And it was very simple. It was, where did it happen? Was it classroom or playground or whatever? Who was it? What did they do about it? How did they record it? So the teacher and head teacher at the end of the week had a very simple data sheet. And what it confirmed were some things, such as they said, I've forgotten this day, but say a Thursday has always been a really manic day. And to write on the Thursday, they'd noted down far more concerns. They now had the evidence and knew they had to do something about it. That hunch was confirmed. They also saw that the same child raised concerns for both of them. In the same day, there were some duplications, so they could improve the process, but they also had immediate learning from it. And the biggest learning was to communicate with each other about those things in the middle of the school day. So in the longer term, it would save them time of duplication, but it would also be far more effective for the child or family if always the same person reacted to the concern. So that was a very simple way of using data and feeding it back immediately, so much so that they now said, well, they'll do it every few months or so. They'll do a weekly sheet and see what comes out of it. And it was the regular looking at data, I think overall is my summary answer. It's the regular looking at data, feeding back data to people who can do something about it. You know, not just any old people. That seems to make the biggest difference for both families and practitioners, and then managers where it's fed up. Jane.
Thanks so much for your observations, Kirsten. I could listen to you all afternoon. And I think we could probably have a session, you know, just on your experience in Dundee with some of these things. Again, there's a bit more information on the new project on the Celsus website, so if anybody wants to follow up, you could look there. So that the theme kind of coming through from all our participants so far for me is about the motivation that you get when you can actually observe change and how data can play a role in that. So that I think is really crucial and critical to hang on to. So we're going to move on to our final participant of the day. So we're going to move to central government now, and I'm going to invite Craig Kellogg from the stats team at government, who is the person that receives the class return, the looked after return at government, to join us. And I'm going to ask Craig a few questions as well. So first question we put to Craig was, we've mentioned the COVID, the SOLACE data that's collected regularly. So a question we put to Craig was, how is that actually used at government and what impact has it had?
Hi, Mickey, thanks for that introduction. So the SOLACE data, which we've heard quite a bit about already this morning, was designed to be used nationally and locally. And so ministers see this data every week and are scrutinising it, as our policy colleagues across government. And I'll just give a couple of examples of how it's used within government. So an example was in analysis of that weekly data when providing advice to ministers in developing emergency legislation in the pandemic response. And within Scottish Government, the data has been used by leaders to understand resource pressures and to take into account, along with other information, about how to allocate resources within government throughout the pandemic. Of course, the data also informs the work of the Children and Families Leadership Group, which is chaired jointly by Scottish Government and COSLA, and the group's using it alongside other intelligence to monitor and identify issues nationally and locally. And that group receives regular updates on the data from my colleagues. And the group's keen to understand detailed issues highlighted by the data, and is prompting really useful discussions within that forum. And of course, as we've heard, the data is used locally by chief officer groups to understand emerging issues in local areas.
Thanks, Craig. I'm going to roll the next couple of questions together so you can answer these. We asked you what you learned from the data collection, and also if you were doing it again, what would you do differently?
So firstly, in terms of process, I've been really struck and impressed by the resourcefulness and ability of partners to develop and turn around these reports at pace during the pandemic. Mickey's picked up on that point in his introduction. It was the first piece of work that I was involved in when joining the team last April, and it all came together really quickly, all in the first week, thanks to a really impressive collaborative effort. I feel like it's helped me understand the impacts that were being felt by children and families, but also how services were responding throughout the pandemic. So we're also seeing data which hasn't been collected or analysed nationally in the past. So for example, rates of contact with professionals, some earlier measures of child protection activity. So the data has shone a light on issues such as how rates of contact with professionals have changed or been maintained as restrictions have eased, have been tightened, as schools have closed and been reopened. It doesn't provide a complete picture. I don't think that's possible. As Mickey said, our annual statistics don't provide a complete picture. So that wasn't possible given the pace and frequency with which it's developed and been updated. So there's I think that leads me on to your second question, which was about what would we do differently if we were to do this again. And I think it really is worth recognising the pace at which it happened. And I think given the same set of circumstances, so entering lockdown for the first time, and with the same time constraints, the answer is probably that we wouldn't do much differently if we could wind the clock back to March, April last year. But that's not to say that there's nothing that we can learn from it, from the experience. So I think the overall experience as analysts within Scottish Government throughout the pandemic, so looking beyond the weekly data on vulnerable children, but the other regular monitoring which has gone on as well, it's really highlighted the importance of gathering and being able to quickly use and rapidly develop management information close to real time when you compare it with the old world, the lead-in time in the production of annual statistics. We've been doing this for almost a year, and there's no doubt it's a resource strain. I think this comes back to the point that Mickey made in his introduction about developments to IT systems. I think that could really drive some improvement and efficiency in this sort of work. So I think in terms of either reflecting or what we could do differently, it's worth reflecting on what would enable us to do this in a more sustainable way, and thinking specifically about how this function, which is a relatively new function, sits alongside the more routine established data collection and monitoring activity which goes on, for example, in our annual statistics, and to think about the point which Mickey also mentioned earlier on about the need for more rapid or more responsive data. So I think that probably answers your questions, Mickey, but I just think a reflection on it would be that is this set of indicators what we need to fully understand issues relating to potential harm and safety? Are there different types of data that we need to see in order to do that? But that's
yeah, thanks, Craig. And it's useful to be reminded as well about your baptism of fire at Scottish Government. You know, to come into that, it was quite a challenge. I think the SOLACE data, I mean, it has been useful for the sector, but it also inspires fear, because in a sense, the government's appetite has been whetted a bit by it. And as you say, it creates, I suppose, a worry about an expectation of more regular data. And when we think about all those resource issues that we've talked about, that is a wee bit of a concern. So really useful to hear about that though, Craig. I'm going to now turn to the Children's Social Work Statistics Review, which was done in November. I know you've just put out some information from the consultation exercise about that, but I reflected earlier that I think a step change is needed in Scotland in terms of how we think about information around children in need of care and protection. And I think the national collection can have an impact on that. It can help drive behaviour out there and show what's important to some degree. So I guess what I want to find out really is what are the next steps now in terms of that review, and how does it fit more broadly with government aspirations for data in the sector?
Thanks, Mickey. So as you said, last week we published a report detailing the findings of that data consultation, where we were seeking views from users of our statistics on data collections and the statistics that we publish. So if you're signed up to our mailing list, you've probably seen that or should have seen it, but if not, we're happy to share a link. So for the most part, what the report's setting out is a factual description of what we heard in the consultation. We've also described what the process will look like for planning and prioritising developments to those statistics in the future. So those will be overseen by a steering group, which will meet for the first time in the spring. And I think the consultations highlighted, and your earlier comments, Mickey, have highlighted an important role for that group, which is a more strategic role to think about how developments in children's social work statistics fit with wider developments in the sector, and how we as producers of this discrete set of statistics should be connected to those other developments. The group will consider how we're addressing the data issues identified by the promise. For example, to better enable data linkage and to ensure the experiences and outcomes of children are represented in our statistics in a way that they aren't at the moment. And the group will consider how we actually use this as a first step in engaging with users of our statistics. So who do we engage with more broadly? How do we take into account the perspective of children and young people in that work as it develops? And beyond making incremental improvements, which we'll say a bit about, what are the more significant developments that we need to consider? So I see a role for a steering group in overseeing that. And but I'll say a little bit about improvements that we're looking at the moment. So I'm pleased to say that we're close to agreeing the details of how we'll introduce geographical data to these data collections that will enable us to do some area deprivation analysis for the first time. And together with other data that we collect, we'll provide another route to enable linkage to other data sets. And in the short term, we're also looking at data on continuing care, aftercare, and permanence to improve quality in those areas. Other priority areas for us to look at is how we capture data on experiences of children. For example, the reasons children become looked after or why placements end or break down, and what's the information on participation of young people in decision-making meetings, all these sort of measures of participation and experience, which at the moment we don't have much on. And various other things which are detailed in the report.
Okay, Craig. I think within that you mentioned about how you're responding to that data deficit that was identified in the promise. So thanks very much for your contribution there. Again, it'll be a worry to the sector as well as encouraging that government is looking at additional areas where data could be collected, because of course we'll always come back to the resource issues out there and how we could organise ourselves to kind of produce this additional information. I don't think there'd be any argument about the need for it. It's just how we can actually go about doing that. And how, I guess, what COVID's shown us as well is just when we put our minds to something, it's amazing what can be achieved. You know, so a wee bit of a lesson for all of us from that. Okay, so can I thank all our panelists for contributing. We're going to now move to a question and answer session, and I know some of you have been putting questions in as we go. So I'm going to put Alex on the spot, if that's all right, Alex. If you could pick one question from some of the ones that have been asked already, and we could maybe put that to the group, and we'll all have a look through now and see if there's any other questions we think we could deal with now. So if there's anything burning for you, do get it into the question and answer bit. If we don't deal with it now, and we've only got about 15 minutes left, if we don't deal with it now, we can pick it up and respond to that. So we'll move on to question and answers before we close, if that's okay.
Thanks, Mickey. Yes, I'm just looking through the question and answers. So in no particular order, there's a couple that relate to the minimum dataset work. Some I can't answer, and so maybe more for the group here, but one of the questions is around to what extent did the minimum dataset inform the weekly return through the SOLACE dataset? So that's probably a question that Craig could ask or help answer. And as a second question in that one that came from Maria was around the extent to which children and young people have been involved in the development of both datasets. I might just kick off on that one and say that's a very fair question and a real challenge. I think particularly around the minimum data set, it's responding to in the main process data and thinking about how we can enhance practice and the response to children and families through the different stages of the child protection process. We fully recognise that there is a dearth in terms of that indicators that relate to the participation of children, and not just children, and their families as well. We've given an initial nod to that around the extent to which they're attending key decision-making points like the child protection case conferences. But I think, as alluded to, particularly in that last conversation, around we need to do a lot more sophisticated around the participation and voice of children and young people and their experience of that, of those different processes. I thought Kirsten's talk around how to capture the views of children in relation to the Team Around the Child processes, and that can relate to younger children as well as older children, provide some real examples of that. But if I hand over maybe to Craig around the interface perhaps between the minimum data set and the SOLIS weekly return.
Sorry, I was having trouble with my mute button. Hopefully that's working there. If I could pick up as well, there's a couple of questions about the SOLIS weekly return and its future, so I'll try and pick up a couple of those. So I have a question about the frequency of it, how that compares with the class, and Alex has mentioned the minimum data set as well, and also a general question around the likely duration and future of it. So I'll pick up on that as well. I'll start with that. So the future of that return is being considered by a group led by or involving the Improvement Service, Public Health Scotland and Scottish Government, reporting to the Children and Families Leadership Group. And there's a workshop to make those considerations in March. So I don't have anything to announce on it, except to say that it's being considered in a workshop in March. And I have a question here about the frequency of SOLIS reporting compared to class and what differences there are between the two. So they do at the moment feel like bespoke pieces of work, and they are to an extent, but I think the reflection that I wanted to put out was how the two could become connected. And if we look at the experience across other areas of government, there's been quite a big variation in that experience monitoring throughout the pandemic, and we've done pretty well, but it's been a big resource strain at the same time. So I guess the question I want to leave hanging is what would it take to reduce that resource burden while also being able to deliver something a bit more sustainable and to meet a somewhat more responsive data need.
Okay, I think it's quickly coming to me. I'm going to pick out another question, and not a stupid question in any way, and it's probably more for the PACE colleagues. So Caroline's got her hand up, I can see around this. Is what is the difference between a timeline and a chronology? So if I hand over to Caroline on that one.
Thanks, Jenny, for your question. As Alex said, there's no apologies required. As I say, every day is a school day. Chronologies are a written document. There's lots of words. It runs to lots of pages, and often the child can get lost in amongst all those words. So the chronology is really a written document about events that happen in a child's life. What I should say is the timeline is not a replacement for the chronology, but what the timeline is a visual that brings the child to the forefront. So we start to lose all those words and we very much focus on that specific child's journey. The best way to explain the actual timeline is to see a visual. So a wee plug for our PACE website. There is information on the PACE website, specifically 2 webinars, one with my colleague Mickey and one other colleague Linda, telling you a wee bit about timelines, and it does explain a wee bit of the difference as well between timelines and chronologies, and also a webinar from myself there about how to compile a timeline, and also just some general information. I think there's a blog there for our colleague Linda as well about timelines, so hopefully that answers your question there, Jenny.
Okay, back to me. So we've got a couple of questions around capacity and I guess analytical capacity in local areas. And I think that's a key trend that's run through, that we're collecting a lot of data and we plans to collect even more data. And I think it's how we ensure that there is analytical capacity here. So I might hand over to maybe Caroline and Kirsten in a second around how that can be built locally. But I think from my perspective, when we were sharing the minimum data set work across the country, and we had a series of workshops with all committee members and across the country, I think what struck me was that and probably testament to the number of people on the webinar today, there is a lot of interest in data, but I think and a lot of people have points to make. It might not be familiar with statistical data or doing the technical bit of doing run charts, etc. but people do feel invested in data and they can provide the wider insights and wider intelligence to make sense of that data. So I think it's just thinking it's not necessarily a whole new team, a whole new resources that needs to be in place, but it's trying to build on the interests that a lot of colleagues within local areas and partnerships will have and try and lift that up so they're really making sense of data. But maybe I'm trying to look for a hand here from either Kirsten or Caroline who might want to come in here around how to, well, Caroline's coming in first, around the local perspective on building that capacity.
I suppose what we found through the implementation of the minimum data set was that we have very much moved away from making the document data only written by myself, a single agency document that's not analysed in any way by anyone other than data colleagues within social work. So we knew that our current quarterly report that we were writing was very much like that, and we found it really difficult over the years to move that on. So we have really used our CP lead officer as key to that process. So very much involved in the report, very much involved in the analysis of it, but also the link for myself into the CPC about taking some of the issues forward. I also spoke about the use of the multi-agency meeting so that we've got that analysis, and that's another area that we really struggled with prior to the minimum data set. So what we do now is our information subgroup of the CPC has a dedicated meeting. So when a minimum data set report is written by myself in draft, we then take it to a specific group that only looks at that during that time. So we make sure that there's time set aside for that multi-agency analysis, and I think that has really helped not only embed the process but also put more responsibility on other agencies to move away from this single agency type of report, and obviously in terms of capacity that has helped me because the burden is no longer just on a data analyst within social work. So in terms of the minimum data set, that's how it has kind of helped us.
Yeah, I agree completely, Caroline. For the minimum data set, we've also got the subgroup, and that is working really brilliantly. So I'll not repeat what you said. For the Solace, I was very fortunate to get a graduate trainee starting just as the Solace data started. So some of the regular thing has come from an additional resource in Dundee, just really, really fortunate. And I think this is an appeal, which I think a few of us had made, is where the data fits. So the Solace and the CP minimum data set actually have a lot of overlap. So it's helpful, and people have discussed it regularly through the Solace already. So that's helpful. It is where additional indicators come in to look, as with the minimum data set, for something that can be done across Scotland would really help, and maybe drop something that isn't needed. You know, so we don't get swamped. That would be very helpful. Thanks.
Yes, did it again. Okay. There were some questions around what people in local areas have done in response to the COVID crisis and data around that. So as well as that national collection, is there anything you've observed locally about the impact of COVID?
In terms of we spoke about the Solace Weekly data, and very quickly I was pulled into that last year, and we have our public protection liaison group that met weekly at this time, and the information was analysed in really great detail at that point in time. It's now moved to fortnightly, although it's still analysing the data. And I suppose for me, to see that our Chief Social Work Officer sits on that alongside other colleagues, and to see our data getting analysed to such extent is actually quite heartwarming, because a lot of the time the information that we produce reports, we do lots of work, but we never really fully understand if it's getting used. So to see this information getting analysed in great detail has been good for us. I'm involved in the meetings, so I'm able to answer lots of questions, but I speak to a lot of colleagues as well who are working on the ground about what this data does actually mean. So our duty referrals that are coming in, what's happening with them, what pressures is this putting on, and we've been able to identify issues round about more complex cases, the shutting of schools, what impact that's had. We've had interesting conversations about young people absconding, not just from LAC placements, but from home and being reported missing to the police. And we've done a wee bit of individual work round about that and what that means for our local authority. So I think it definitely has helped us highlight certain areas that may look concerning. And I suppose it does it on very quickly because it's reported weekly. So that's probably just some of the areas that it's helped us.
Thanks so much for that, Caroline. Okay, so that's our 90 minutes up, folks. So can I first, on behalf of everybody out there and Celsus, thank our contributors. So thanks, Scott, Pamela, Caroline, Kirsten and Craig. And in the background, I'd like to thank Julian, who's helped set up the event today, and also the comms team at Celsus, who have been doing the work in the background about publicity. I think we will be actually asking you for some feedback, so we'll be sending out something to you for some feedback on the event. It'd be interesting to get your thoughts on the format that we've used today. I think it's been a wee bit clunky at times, and I know some things haven't worked particularly well, and my fat fingers haven't helped either. So it'd be interesting to get some thoughts on that. I'd also be very interested in getting your thoughts on whether you think it's worth having more of these sorts of sessions. And I want to give a shameless plug for a community of practice that Celsus is hoping to set up around data. So if you're interested in that, it would be great if you could volunteer your interest to us. In these GDPR days, we can't use information you give us for one thing for another very easily. So we'll be looking for expressions of interest to join a community of practice. And through that, we would hope to share sessions looking at specific topics maybe that might be of interest to you and things like that. So shameless plug over. I think we'll draw the meeting to a close there. Thank you all around the country for taking the time to join us, and I hope you found it of interest. So we'll stop there. Thank you very much.